Okay, let's be real. If you've ever had one of those stubborn backaches or a headache that just won't quit, chances are you've reached for a little pill called Naproxen. You probably know it as Aleve, right? It's in pretty much everyone's medicine cabinet for one simple reason. It just works. But there's a really fascinating story behind how it actually does its job.
And that really gets us to the heart of what we're talking about today. Why is this super common painkiller both a powerful friend and, well, a potential foe? To get to the bottom of that, we actually have to dive into how our bodies deal with pain and inflammation to begin with.
All right, so let's start with the good stuff. What makes Naproxen the go-to for so many people? Well, its power. It really comes down to what it's targeting inside our bodies.
So officially, Naproxen is part of a drug class called NSAIDs. That's a mouthful. It stands for Nonsteroidal Anti-Inflammatory drugs. And just like the name says, its whole mission is to fight three things: pain, inflammation, and fever. You can grab it over the counter as Aleve or get a prescription for it, usually called Naprosyn.
And the range of things it helps with? It's honestly incredible. We're talking everything from that muscle sprain you got trying to be a weekend warrior, all the way to the chronic, nagging pain of arthritis. It's often the first thing doctors recommend for menstrual cramps, it's a super common fix for migraines, and it can even tackle the intense pain of a gout attack. It's like a Swiss Army knife for pain relief.
So how does one tiny little pill do all of that? Well, the secret is in a mechanism that works kind of like a two-sided switch. And this switch, it's the source of all of Naproxen's power. But, you guessed it, it's also the source of all its risks.
Okay, let's use an analogy here. Think of your body's internal system as having two key enzymes. First, you've got COX-1. Let's call it the housekeeper. It's on 24/7, just quietly in the background, protecting your stomach lining, making sure your kidneys are working right. Then you have COX-2. This is the alarm system. It only goes off when you get injured, and it's the thing that sends out all those pain and inflammation signals.
So here's what happens. You get hurt, and that COX-2 alarm system starts blaring. You take an Naproxen, and it comes in and just silences that alarm. Problem solved, right? Well, here's the catch. Naproxen can't tell the difference between the two enzymes. So while it's shutting off the alarm, it also shuts off the COX-1 housekeeper. The result? Yeah, the pain is gone, which is great, but your body's essential protective systems are also temporarily offline. And this whole effect, it lasts for a long time. Naproxen has what's called an elimination half-life of 12 to 17 hours. Now, to put that in perspective, that's way longer than something like ibuprofen. It's the whole reason you only need to take it once or maybe twice a day. It gives you that awesome long-lasting relief, but it also means that your housekeeper enzyme is shut down for a really long time too.
So you combine that long-lasting effect with the fact that it's shutting down that protective housekeeper enzyme, and yeah, there's a cost. This is what we call the price of relief.
You know, one of the sources we looked at just nails it. It says, this dual inhibition is the source of both Naproxen's benefits and its most common side effects. See, it's not a flaw in the drug. It's literally how it's designed to work. They're two sides of the very same coin.
So what happens when that housekeeper is off duty? Well, the first, and probably the most well-known risk, is damage to your GI system. Without COX-1 doing its job and producing those protective compounds, your stomach lining is basically left defenseless against its own acid.
At first, this might just feel like a little indigestion or heartburn. But if you keep using it, it can escalate into way more serious problems. I'm talking about things like bleeding, ulcers, or even a perforation, which is a literal hole in your stomach or intestines. And the really scary part? These serious things can happen with absolutely no warning signs.
Okay, risk number 2. This one involves your heart. We know that long-term use of NSAIDs like Naproxen is linked to a higher risk of heart attack and stroke. And this is especially true for people who already have heart conditions to begin with. And then there's the third major risk, your kidneys. Remember how we said the COX-1 housekeeper helps support kidney function? Well, when you shut that down, it can mess with your kidney's ability to filter your blood properly. This can lead to things like fluid retention, swelling, and even higher blood pressure. All right, I know. After hearing all that, you might be feeling a little nervous about that bottle of Aleve in your cabinet. But look, knowledge is power here. Just understanding the risks is the first most important step to using this really effective medicine safely. So what are the rules of the road?
Let's call these the rules of engagement. The goal is always to use the absolute lowest dose that actually works for you, and for the shortest time possible. Period. To give your stomach a hand, always take it with some food or a glass of milk. And you definitely want to avoid or at least limit alcohol, since that also irritates your stomach. And for the stuff you buy at the store, the rule is crystal clear. Don't use it for more than 10 days for pain unless your doctor gives you the green light.
Now, there's another really critical point we need to cover. Naproxen doesn't exist in a vacuum, you know? Taking it with certain other, very common medications can crank up its risks in a big way, creating a pretty dangerous combination.
For instance, if you take naproxen with other NSAIDs or with blood thinners like warfarin, your risk of serious bleeding goes way up. And get this, even some common antidepressants, the SSRIs, can increase that bleeding risk. Mixing it with steroids like prednisone, that's a huge red flag for stomach ulcers. And if you're on blood pressure meds, naproxen can make them less effective and raise the risk of kidney damage. It's a double whammy.
So here's the bottom line. Naproxen is an incredibly powerful tool. It's an expert at silencing your body's alarm system to give you relief from pain. But it pays a price to do that. It also has to shut down a really important protector. It's a trade-off, plain and simple. So now that you know the whole story, the good, the bad, how it works, are you ever going to look at that little pill in your medicine cabinet the same way again?